Welcome to the Tenet Healthcare Medical Minute. I'm Julia Yarbo. Today's topic is interventional cardiology, and joining us is our guest, Dr. Rahul Aggarwal. He's a board-certified interventional cardiologist specializing in cardiovascular disease and interventional procedures. Dr. Aggarwal is a member of the Tenet Florida Heart and Vascular Network, and he practices at the Heart and Vascular Institute at Palm Beach Gardens Medical Center. Dr. Aggarwal, thank you so much for joining us.
It's my pleasure.
So explain to us exactly what is interventional cardiology.
It's really being a plumber specifically of the heart. The interventional cardiologist, really this field has developed over the last 30 years. Once we figured out how to place a balloon within the side of a coronary artery, the whole field took off. So from the 80s we had the balloons, in the 90s we had stents, in the 2000s we had medicated stents, and now we're starting to move on to newer territories in that realm. So the bulk of what we deal with is really atherosclerosis of the artery, trying to figure out how to fix that, how to open that up and restore blood flow in the arteries. The most common procedure for that is a coronary angiogram, also known as a left heart catheterization. We look at the coronary arteries, and if we find that there's a blockage, we take care of it. If the vessels are too diseased, then we would refer them to a cardiothoracic surgeon, and they would consider bypass surgery at that point. But in our realm, we deal with stents. For many years, we used to deal with going through the leg. But recently, as the equipment has gotten a lot smaller, we're now going more through the wrist, particularly the radial artery. This allows for shorter downtimes and fewer complications. And so this is the direction. Everything's moving towards smaller and less invasive.
Now this is where the patient comes in. Talk a little bit about preventative measures that an individual can take so that they don't need any of these procedures.
And we've always said diet and exercise. We've also looked at genes, and genes is still going to be years before we start looking at how to help that. But in terms of diet, this is a moving target. You know, we went through the low-fat craze for 50 years. By going to a low-fat diet, we actually introduced a high amount of carbohydrates. And by consuming a high carbohydrate diet, we developed diabetes, more strokes, more blood pressure problems, more obesity, and now we have an epidemic of coronary artery disease. So this field is evolving, and we're starting to take a step back and say, you know what, certain fats are actually pretty good for us. And so that's what we're starting to incorporate into our patients. A lot of them are cutting back on the refined carbohydrates. It's not always about the fat. There are certain good fats that are actually very appropriate for heart health, but it's also about cutting back on refined carbs. And the second question that a lot of folks they ask about is, what about the cholesterol? Cholesterol is not as bad as we initially thought. You see, it's not cholesterol that kills us or blocks us, it's oxidized cholesterol. And what oxidizes cholesterol? It's refined carbohydrates, smoking, and a lack of a nutritious diet high in antioxidants. In other words, you need a lot of antioxidants. You need to stop smoking and get rid of the white flour, the sugars, to really help that.
There's some great information so that we can all have healthier hearts. Thank you so much.
My pleasure.
And thank you for joining us. For more information on Tenet service in Florida, please visit us at tenetfloridainternational.com or call toll-free at 1-855-854-4868.